First of all, there's an overview of compliance with paragraphs in the settlement agreement that were approved and received substantial compliance in 2018, but were not revisited in 2019. So we cover force, community-based mental health services, crisis intervention, and employee information services in that category. We update those. And then I'll give you a quick status report on the paragraphs where the city or PPB had not achieved substantial compliance by the time of our last report, July 1st, and that's training, accountability, and community engagement. And then we'll finish off with those, and it's a good place to end with the community engagement. I'll refer to the Portland Police Bureau as PPB just to be short, and I'll move quickly through this. So let's go to the force slides here, 3 paragraphs. We found that the PPB has continued to enforce the 2 force directives, 1010 and 101010. These directives instruct officers and supervisors about their responsibilities for all use of force events. For instance, they cover the requirements pertaining to force reporting, supervisory responsibilities, and lethal force. Related to force reporting, we've reviewed their FDCR report, which is their force data collection report, very carefully. It does capture all the key elements that we feel are essential to get a candid, complete account of force. After a force event, supervisors on the whole are doing a good job of reviewing these force decision makings by officers. We've looked at the force reports ourselves, and they're interviewing witnesses, making decisions as to whether any directives were violated by the officer using force. And also our analysis shows that these after-action reports by supervisors are being completed 99% of the time within the 72 hours that they're required to be completed by. And they have to notify Professional Standards Division, PSD, in cases of serious use of force, force against persons with mental illness or suspected misconduct. And then PSD actually is required to include all the same material that is in the after-action report that supervisors would do. Our analysis shows that these processes are fairly complete and accurate. We've done a lot of sampling of different cases. Finally, paragraph 71, the PPB is required to maintain their supervisory levels, and we use span of control as a metric here, which we think is good. And currently it's 5 to 1, so 5 officers to 1 supervisor. We consider that acceptable, and they've maintained that throughout these 5 years. I should say, for those of you who are new to this, including maybe some of the PCCEP members, that this is 5 years we've been doing this in Portland, just so you know, and we've spent a lot of time, and I'll come back to that issue in a minute, because in terms of progress being made. Let me move on to force to custody. This gives you, we tracked the use of force levels over the past 3.5 years, and they've consistently maintained a force to custody ratio of about 3 to 4%, which means for every custody, arrest, detention, force is used about 3% of the time. So 97% of the time it's not being used. And this is pretty stable even after they've expanded the list of actions that are defined as force. In the last year, they've expanded that to include more minor incidents of force, such as resisted handcuffing. So the big picture, though, frankly, it's not listed here, but force is a rare event. For those of you who don't study this, it's about 1/4 of 1% of all the calls that come in. And in terms of mental health, which is the main focus of the settlement agreement, there were nearly, in 2018, where we have complete data, there were nearly 26,000 cases that an officer defined as someone perceived to have a mental health condition. Of those 26,000, 0.7% ended up with the use of force. So 99.3% of those officer contacts with people having a mental health condition did not result in force. So I just want to put that all in perspective, because sometimes we lose track. Now, of the cases that did involve force with a person with mental illness, when force was used, it tended to be at the lowest level. There's 4 levels of force in the police bureau. Level 4 is, for example, 69% of those, of all the force incidents were level 4. And 49% were control against resistance, where a person is somehow resisting something and the officer has to control them, and resisted handcuffing. They refuse to put their hands in front or behind them, so they assist with that. But there's no hitting, no spraying, no tasering, no shooting, none of that. Just want to be clear that you understand what's going on with a lot of these cases. Community-based mental health services. Okay. Now this is clearly a debated subject, and I look forward to hearing more about it tonight, about the adequacy of the coordinated mental health and addiction services in Portland and providing enough walk-in centers. But I do want to stress again from our perspective that the crux of paragraph 88 is that the primary responsibility for a comprehensive mental health system falls under the purview of the state and community-based mental health service providers. So we, in part of our job, and I'll say this throughout my presentation, we look at what the settlement agreement says. We're responsible for the legal terminology there. You could debate whether this should have been in there or how it should be handled, but we look at, did PPB and the city have they done what they can within their power? We said they've continued to act with their partners in the overall delivery of community-based mental health services. For example, the Behavioral Health Unit, BHU, does include state, county, and local representation, mental health service providers, and persons with lived experience. And again, paragraphs 89 and 90, the requirement of the settlement agreement places the expectation on the community care organizations, not on the Portland Police Bureau. So our hands are kind of tied in terms of who's responsible for this stuff. And these include creating a drop-off center and establishment of the committees. Where possible, I think PPB has assisted in bringing these requirements to fruition, including participating in the transportation subcommittee and the prior CCO subcommittees. Now, we acknowledge that this community concern about the Unity Center and CCO subcommittees, but again, it's an issue of whose job it is to deal with that, and I look forward to that discussion. We believe that in this case, they've made a reasonably good attempt to partner with folks and to serve on these subcommittees. So we can come back to that. The next one, let's see here. No, I guess I can't. There we go. Crisis intervention. A number of paragraphs here, again, critical to the settlement agreement. The Behavioral Health Unit, BHU, and the specific teams within BHU continue to comply with the requirements of the settlement agreement. For example, BHU's leadership structure conforms to paragraph 91 with the high-ranking lieutenant overseeing those committees, those teams, the Enhanced Crisis Intervention Team, ECIT, BERT, the Behavioral Health Response Team, and Service Coordination Team, SCT. The Behavioral Health Unit, BHU, collects, utilizes, and shares data and information in a manner that conforms to the settlement agreement. There's a number of paragraphs that do that. They have an analyst there that's doing some serious work. For instance, they continue to utilize the mental health template. That's a form the officers fill out when they think someone, there's a mental health crisis or situation, whenever an officer interacts with someone. Now, PPB uses the template to identify those who come into regular contact with PPB. That's 3 templates within a 30-day period, and make referral to the Behavioral Health Response Team, or BERT. And they have implemented a regular audit function of the mental health interaction data. For instance, they recently identified a slight increase in police contacts among BERT service recipients 60 days after service. And although this is still below the level of interaction that occurred before BERT started, which is some evidence that the BERT program, we've reported that previously, is helping. But the BERT team is now follows up with their clients prior to the 60-day time period. So there's more intervention there. As part of the Behavioral Health Coordination Team, PPB and other entities within the mental health service delivery system continue to share non-confidential information when an individual has repeat contacts with PPB or represents an escalating concern. PPB has maintained its relationship with Multnomah County Crisis Line by sharing BERT referrals with them. The BHU Advisory Committee also continues to meet regularly and provide recommendations to PPB. The advisory committee members include representatives of all areas of mental health response. There we go. All right. More on mental health crisis. The crisis intervention remains a core competency of PPB officers, with all officers receiving a minimum of 40 hours of pre-service training and annual in-service training. Additionally, the enhanced crisis intervention team officers continue to receive an additional 40 hours of training prior to becoming an ECIT officer. I do want to stress, for those of you in a national perspective, that's way above what other departments do. Behavioral health response team officers are also required to attend the ECIT training. Let's see, the service coordination team continues to serve those with high rates of criminality and addiction. Finally, in April of 2019, BOEC at the Bureau of Emergency Communication, or your 911 center here, conducted an in-service training that reinforced the notion of when in doubt, send them out, which is means send out the ECIT officers. We've been arguing all along that these officers are specially trained and have special skills to handle these situations. And we would like to see them sent out more, and in fact that has happened. So they did an in-service training on the dispatchers and the call takers, and after receiving that training we noticed an increase in the number of ECIT calls compared to a year earlier, as well as an increase in the proportion of mental health calls that were dispatched as ECIT calls. So in sum, we maintain that PPB has substantially complied with the paragraphs within the crisis intervention section of the settlement agreement. Please remember that this was the primary focus of the settlement agreement, and in many ways, we would maintain at this point in time, after 5 years, that Portland actually is a model for other cities. The PPB mental health model, not necessarily the whole citywide model. Because that's a whole nother issue. All right, let's move on to employee information. Employee information systems essentially look at any potentially problematic trends in an officer's use of force, and if that officer exceeds a certain threshold, such as 3 or more complaints in a 6-month period, a threshold that would trigger a case review for that officer. It took a few years to get this requirement in place. That we pushed pretty hard for this, but now PPB has maintained its EIS thresholds and added some. There's 8 events now that can trigger a review. Our analysis is they've been managing those reviews pretty well. They send a lot of alerts on to supervisors, which can be overwhelming at times, but they've figured out a system to do that. PPB also continues to utilize a risk management approach to identifying potentially problematic officers. By this I mean they're throwing lots of variables into an equation and looking at what factors predict various outcomes. For those of you who remember your statistics class, like a normal distribution, most people are in the middle, and out at the tails are the people that, like, 95% of us fall within 1 standard deviation, and 99% of us fall within 2 standard deviations of the mean. But if you get, 3 standard deviations. But if you get out, so here they're looking at who are the officers who are 3 standard deviations from the mean. All right, they're in the 1% that are that far from the mean, and those that are 5%. And what do we know about them, and what factors predict their behavior? So this is the kind of thing that I was hoping they would do, and they're now doing. And finally, I'll just say that PPB, again, conditions of settlement agreement, employs EIS administrators. They have 2 now, and they've created an EIS manual that memorializes all this for future training of administrators. So nothing's lost when people move around. Now I'm going to quickly update you on sections in the settlement agreement that were not in substantial compliance last time we wrote our report, which was the end of June, and the second quarterly report. So we had to update those and focus on those paragraphs in the settlement agreement that were not in substantial compliance. Officer accountability, paragraph 121. In the past we've noted that both PPB's Internal Affairs Division as well as the City Auditor's Independent Police Review, IPR, have struggled to complete the administrative investigations of officer misconduct or complaints of misconduct within the 180-day timeline from the settlement agreement. And this has presented a big challenge for both groups. And however, I do want to say that both groups have worked very hard in the last year, held many meetings. We've attended a lot of those. We've been all involved in this. They've introduced significant managerial and procedural changes in the way they do these investigations, such as case management strategies. They now hold weekly meetings. They share mailboxes to increase efficiency. They review these overdue cases. Why is this case running so long in the investigation? Let's see what the issues are. They work in coordination with BHR, which is sometimes involved, human resources, as needed, and they provide advanced copies of materials to unit managers, that was slowing up the process. And there are other things as well. I just list a few.